Uh-oh. An error occurred. What? Wait a minute. Let's try. Let's go live. Come on now. Oh, what's up? What's up, everybody? How are you? Happy Monday. Can you believe it is October the 4th, and this is Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Assemblyman, Reverend Al Taylor in the building. But we got so much to talk about. Can you believe social media was shut down for hours today? Instagram, Facebook, WhatsApp. I didn't know who to talk to or try to talk to. Then you
Wow.
can't, but I mean, thank God we're still on YouTube and Facebook Live, but I couldn't even get that for some of you who are always comfortable to watch us via Facebook. It was something else. But with that being said and saying all that, it is the 4th of October already. Like, time is flying. Can you believe that? That's just crazy to me. But God is good. We're all here, right, Al?
Yes, absolutely. We are here in the place to be. Thank you so much. Quite frankly, um, I didn't miss not one of those social medias, man. I was in full throttle and never stopped it. I heard it when I jumped in my car. I heard 1010 reporting that those platforms were down, but I was on the block. It was raining. We were going through my hood with some people. Got a young man that's going to join my team from Morehouse. He's going to spend a year with me before he goes on to law school. So we were walking through the community. Um, I ain't known about no stinking breakdown, man. Not in my neighborhood. We were doing what needs to be done, servicing the people. But I just want to pause and thank Roger for joining us. I want to can I introduce, give him his title and all of that, and then we'll rock.
Do all that. This is your show,
All
brother.
right,
Go ahead.
there it is. Hey, listen, welcome to Real Talk. You got your main boy over there, none other than Bill Foster and Al Taylor. Thank you so much for joining us. We have Roger. Is that saying it right? Milner.
Milliner, yes, Milliner.
Millender, there it is. So this is some stuff that I put together. So stop me when I get it wrong. He is the Chief Growth Officer for Metro Plus. He's been with them 20 years. And as a native New Yorker, Brooklyn, for all my Brooklyn out there. We're in Harlem, but it's all good. I like heavy, nothing but love for them, right? He began his career with Metro Plus over 20 years ago as a marketing representative, and he oversees 3 departments and manages a shift of over 400 employees. Man, I have a hard time with my 5. Since rejoining Metro Plus in 2000, when the health plan's membership was slightly over 50,000, he's been instrumental in increasing membership, check this out, by 930%. That's almost a G. 930% to his current membership of over 525,000 members. So he's been impactful, insightful in impacting health care as executive to help shape some New York City and New York State's current healthcare policies and government-sponsored programs within the state of New York. And I think I'll stop right there, Raj, before we put him to sleep. Your bio is so long, but I want to say he's a friend. I met you almost 4 years ago to this season as a new legislator, and you came alongside. And I know you guys do a lot of wonderful things. I'm going to have you unpack that a little. But what I liked and enjoyed most about you was your ability to serve and meet the needs of the community. And borders and boundaries don't stop you. So a lot of kids appreciate all the toys and back to school stuff that you get involved in. But now we want to unpack this a little bit later. I don't know where the commercials come in and when we pause and all of that. But let me say welcome. And thank you for joining us in such a short amount of time. We were hanging out, and I'll let Michael tell you, no, we weren't hanging out. We were in the place to be in Harlem. It was so liberating, so spectacular. Super shout out to Uncle Willie. Uncle Willie, bless you. So thank you again, Roger. And I'm going to move over here and let Bill jump in, and then
Anytime.
Well, what's so funny? You're right, because I had the pleasure of meeting Roger that Thursday, and for those that don't know, we were all involved in a support / fundraiser for primary hopeful, mayor hopeful Eric Adams, and it was a successful event. And with that being said, I'm going to ask you two gentlemen, what was your takeaway from that event? Because we were all there in support of Eric and Uncle Willie, of course. But Roger, I'll start with you and let me know what you took away from that. Did you, enjoy the speech? what did you take away, and why are you supporting Eric? So go ahead, Roger.
Well, I was truly inspired by the words of, as you said, the mayoral hopeful, especially in the line of business that I work in. He would actually be my boss, only two or three people removed. So I was truly inspired to hear his leadership and his vision for the city, especially when he talked about uplifting the city. Metro Plus is a health plan that focuses primarily on the lives of the consumers and the residents of New York City. And when you hear someone who may be taking the thrones of running the city and their vision on making sure that you look at people's total situation, I found it to be something that was very inspiring for me and my staff to go out and do as we do our public service work. So I look forward to his vision, his leadership as potential mayor, what he wants to accomplish to make the city a better place. And I truly walked away feeling that the city was going to be a better place with him at the helm.
Absolutely.
Oh, wow.
Al, what was your takeaway?
Oh, wow. Listen, everybody here, Real Talk, we always keep it 100. And I had three things to take away. First, in all transparency, we had the discussion because I was not supporting Eric at the beginning. I won't even mention who I supported. You can go to the Real and see what it was. But and I'm going to say this publicly. I am so disappointed in the person that I supported, not for reasons that you may think, but not being a person of their word. So I'll stop right there. But I found what Eric just said, what Mayor hopeful candidate Mayor Eric Adams said was more action was reality. I'm unpacked up there real quick for you. One, he says we have to start going upstream to catch those that we've been discarding. Why are we waiting for them to show up in the prisons and all these other places? We need to fix what it is that puts them in that position. So I was inspired by that. And as I started in the beginning, I was not supportive of Eric. I was on the wrong team. But one of the things that he said, and I've seen him, he emulates this, and it's something that others should do. He's a team player. He said it doesn't matter what jersey you wore up until that point. Now it's Team New York. That's the jersey that we're going to wear. And those were not just words. That's his DNA. Since the November election and his the June primary, he and I have had a lot of interactions together, and he's a man of action and certainly a man of his word. So nothing but kudos, and as Heavy would say, nothing but love for him. I'm
Absolutely.
inspired.
I think it was the one thing, the more and more I get to hear him speak, because he has been a guest on this show before, and the more and more I hear him speak, he's a very a good speaker. I think if you listen to Eric speak, if you weren't a fan of his before, you would become. I think he gives you a wholesomeness. As we say, it seems like he keeps it real. You understand what I'm saying? And he knows the business. He's had his foot in politics, and also sometimes with law enforcement. That's how I've met him. You have to be a politician, a peacemaker. So I think he knows. And listen, he's been. Brooklyn loves him. So that's a big city. That's a big borough, and he's done a good job with Brooklyn. So I really think that I wish him all the luck in the world. We got to still keep pushing and make sure we get him there. Because you never know what the other half will do. We don't have to talk about Curtis Lewa, but now I guess he's just reliving the Guardian Angels. He's keeping his tam on, but it is what it is. And this, everybody, just for if you don't know, this is Real Talk Chronicles, and this is where Real Talk, we talk about everything. It's opinionated with a lot of factual show. We're here every Monday, the first Monday of each month with Assemblyman Al Taylor. This is Real Talk with Assemblyman Al Taylor. The second Monday of the month, we're here with Dr. Marilyn Corder. The third Monday of the month, we're here with the First Lady of Def Jam, Allison Williams. And the fourth Monday of the month, we're here with Pastor Kevin Graves. And those are old real talk, spiritual talks, conversations that we, they all have a title, expertise in something. But as you can tell, if you listen to our podcast, we converse about anything and everything. And that's a beautiful thing about what we do. And every Wednesday, I'm here with Kevin and Chuck, and we talk about a lot of other things in college and law enforcement and stuff like that. So with that being said,
Mr. Foster, before we move on, I just want to add, a few more points that I thought of as, Al was speaking, and hopefully, I could call him Al because he's a friend of mine.
Absolutely. You can call me Al.
Yeah.
But in addition to me being inspired by his words, I mean, there were some critical pieces that I could see the connection between healthcare and what his agenda and his platform is all about. Al, you mentioned about, things that stop the pipeline that drive people into prison and to incarceration, which he talked about. And when I think about the work that we do in healthcare, he was speaking to things that I could relate to, things like ending all of this substance abuse and opioid addiction that's going on out there, because that leads to incarceration. He talked about mental health being another impactful thing that creates and puts people in prison because mental health is not being addressed properly in our healthcare system. He talked about all these health disparities. We saw the pandemic, ravage through communities of color and adversely affect people who are Black and brown and Hispanic. And those things lead to incarceration. And then he talked about just addressing a lot of the social determinants of health. And so those are all, topics that are front and foremost to us in the healthcare industry that he will make a part of his administration to address: substance abuse, mental health, health disparities, social determinants of health. And so, again, I was inspired because I know that that's something that he's passionate about, and he sees the correlation between poor health outcomes, poor health disparities in certain communities, mental health that goes unchecked, substance abuse that goes unchecked, and its direct correlation to crime and imprisonment, et cetera, et cetera. So, those are just
Roger, what I want you to do, I want you to elaborate a little bit more because you hit a lot of topics, and Al and I chime in with that. So first and foremost, just a shout out to Uncle Willie's in the building.
Uncle Willie.
We just gave you accolades, Unc, and told you how great a fundraiser that you put on, and all the support that was just paramount in that room that night.
Can I add something to you right there, Bill?
Sure, go ahead, please.
The room, and I mentioned this to Uncle Willie. Everyone that's ever been in a fundraiser room and you kind of get it, what it's like. It was not that. It was not that. The people in the room, I walked away like Roger and I reconnected. There were a couple of different people that I didn't even know, but I felt like I had a relationship with every person in that room. We worked together. We could work together. Sometimes when you go in those rooms, I gave the most money. You don't know who I am, and everybody's trying to. But there was a sense of community, if you would. There was a sense of genuine affection and real conversations were being had. And I saw people that normally are so busy, they're gone. They stayed. They hung around to clean up and move the tables. Time to go, because they were enjoying what we would call in church the fellowship, the genuine love. I saw somebody eating a steak bigger than Texas when I left, but I ain't saying who. But I'm just saying people having fun and genuine fun. I just wanted to throw that in there.
No, it really was a Harlem-esque feel. It almost turned into a business party. Like it really. Yes. It was like, well, you didn't want to leave. And like. When you looked at the time, you was like, what? Like, it's like, we just really enjoyed ourselves, really did. So shout out to kudos to
Uncle Willie.
For doing this thing like always. So Roger, you talked about a lot of things. You mentioned a lot of things. Please elaborate on what would you like to do? Like you talked about how drugs affects crime. You talked about healthcare in its entirety. Just break down some points which you could see how you could be working with the mayor, how drugs is correlated to crime and things of that magnitude. And what would you want to do as a chief officer in this situation? How would you be? What would you like to suggest and put in play?
Well, clearly, because I'm an executive in a health insurance company, I know that a lot of times people don't have particular healthcare issues addressed because they either can't afford the treatment, they don't know how to access services. Access is important because if we don't expand on outreach and education to make sure these communities are aware of the various programs and funds that are available to them to address these things, they'll continue to go unchecked. So I'd love to work with the mayor to expand on outreach efforts of education about the affordability, the accessibility of the healthcare system. I think that not to get too political, but we do have a leadership in the White House that is pro healthcare and that has put a lot into making sure that the ACA, which is the Affordable Care Act, remains thriving and well. And I think that it trickles down to the local government. So you have, Democratic, a party in the White House, and then you have to work with the local politicians to enforce or to promote these agendas. And so I love to work with Eric to advance the philosophical ideas of the White House and what the Biden administration is trying to do in regards to expanded healthcare, to address homelessness, and things of that nature. So those are key ways in which, I think him being in that role, especially with New York City having gone through a lot of ups and downs in regards to the pandemic. We were the hardest hits. We had the most amount of deaths, etc. And so coming off of this pandemic, we're going to be dealing with a lot of things like, mental health and suicide rates and depression and all these different things that the healthcare system has to now address. Social isolation. All of those things are coming. And we see the rise in numbers because of having come off of almost 2 years. I mean, it's hard to believe that we were in this since, 2000, and we're getting ready to go into 2022. So 2 years of dealing with a pandemic reaps havoc on the healthcare system. And, we in that industry have to work together to make sure we address all these things that are going to come at us as the result of this. It trickles down into education that was impacted, et cetera, et cetera. So there's a lot to be done. I just can't express how much we got to address the financial impact to the city. How many people, lost jobs? How many people, found their incomes, dramatically reduced because of people not sort of moving around and not interacting. I worked closely with industries like the hotel industry that laid off thousands and thousands of people when those hotels in New York City closed. They were left. Some of these people were the income breadwinners of the family, and when they lost their jobs, not only did they have to deal with financial impact, that person might have been the same one who was who had the health insurance for the family. And when they lost their job, they didn't just lose income; they lost their health insurance as well. So when we worked closely with the hotel industry and the hotel fund, the union that sort of represented them, we enrolled, upwards to 10,000 people in a 2-month period, and that's just one sector. We did the same with the rideshare industry, Uber, Lyft, and all of those rideshare companies that saw a dramatic reduction in their rideshare. We were there to kind of support them and help fill the gaps to help them get insurance. And I can go on and on. You talked about freelancers when you started the show. That freelancers was another one that saw dramatic sort of impacts because of the pandemic. So I don't want to steal your whole show. I just wanted to
listen, Roger, you are the show tonight, brother, because you are people a plethora of information that I'm sure they didn't know or don't know, and you're giving your personal and your professional feelings, and that's what's important with Real Talk. It's about just keeping it real and giving the information to the people in the community. Uncle Willie said, I've worked with Roger on a number of projects. He's a good guy. Love you guys. Especially once this eviction memorandum ends, a lot of people are going to go crazy. What's up, Jonas? What can you elaborate when somebody loses a job? They lose their insurance.
Mm-hmm.
What happens? Because that insurance is, I think, when you get a job, the one thing besides a salary is is you want good benefits.
Right.
Yes.
So can you elaborate on that? Because I mean, I know with housing, people were not being evicted due to the pandemic.
Right.
Did that happen in the insurance field? Or
yeah.
No? Go ahead.
Very good point. I'm glad you brought that up. Listen, we could have not had the best person running for a presidential office when this was all going down, because it could have went a lot differently. A lot of things that were done during the pandemic and after the height of the pandemic, because of the Biden administration, really helped us to not be in an even worse place. The American Rescue Plan, which was something that was enacted after the pandemic and after the change in the leadership there, really made a difference. And I'm starting at the highest level from the federal government and working my way down, that simple things like increasing the amount of subsidies and tax credits and financial benefit that someone can get in order to qualify for health insurance went a long way. So that was one of the major things, that they increased the amount of subsidies, they increased the amount of tax credits that someone can get to make health insurance more affordable. They eliminated the co-payments and the monthly premiums in some lines of business. So for example, we take it for granted that a small premium payment like $20 for somebody who had the essential plan, you mean what? They can't afford $20? Yes, some people couldn't afford $20, and they eliminated that $20 co-payment. They added in dental and vision as part of the standard benefit package and said you won't have to pay separately to get dental and vision. That's going to be part of the standard benefit package. So these little things, they made telephonic enrollment available so that people can telephonically call in to enroll and wouldn't have to worry about leaving the comfort of their home to go out into an environment where it might have not been safe. So making telephonic enrollment something that was important. Suspended, let me get to the root of what you asked me. They suspended the renewal process. Normally, every year, people on Medicaid and other government-sponsored programs, they have to recertify every year. And that process could be, daunting, because there's paperwork that has to go into it and all of this other stuff. Well, they suspended the renewal process and gave people 2 years of extended eligibility without needing to worry about recertification. That was priceless. So, I can't tell you how much it made me proud to be, in a state that was progressive like New York, working with a progressive government at the head of the New York State of Health at a time that we needed it the most in a city that was hurting. And to me, it all started from who was running the show at the White House. And we could have been in one of these states that didn't care about these things and figured people just got to figure it out. So,
Roger, can you do me a favor? Can you explain to the people, the Real Talk listeners, how hard it is to work with certain administrations that are not in favor of healthcare in certain situations that we're trying to build for people?
Oh yeah. So, I'm a strong believer in the ACA. Is it perfect? No, but nothing is. But I feel, the numbers speak for itself.
Right.
The amount of people that are benefiting from the Obamacare, since it's Real Talk, I'll call it Obamacare.
Exactly. Yes, sir.
That program has helped so many people, not just Democrats, but Republicans, whites, blacks, Hispanics, people who voted for him, people who didn't vote for him, and some of the very same people who, was against Obama is benefiting from Obamacare because they have health insurance because of it. So, I think that it's very important to work with local administration. That's why I like working with people like Al Taylor. That's why I like working with people like Willie Walker. That's why I like working with people at the chamber level, like Lloyd Williams, and all these people who do so much to promote and educate consumers about a variety of topics, not only healthcare, but a variety of topics. So if you don't have a good work, I feel that I have a very good, and my company has a very good working relationship with a lot of different politicians and elected officials at every level, from congressmen to assemblymen to the people who work directly at the mayor's office. You have to have a working relationship with the mayor. You have to have a working relationship with the city council, because all of these are stakeholders. They all represent different communities, and communities have different needs. So one of the reasons why Metro Plus is so successful is because we're local. We're super hyper local. We don't have to worry about our mission and our focus being diverted because we're trying to deal with a national agenda. Our agenda is local. And so when you look at the commercial plans who are only in this for profit, they don't know how to work with local elected officials because they're too busy thinking about profit margins and satisfying shareholders and stuff like that. And they don't really come down to the local level. I like working with local people like Al Taylor and others because we're touching real lives and we're impacting real people. And when I do things with Willie Walker, when he was running the Harlem State Building, that's where you make the progress. That's where you help and touch people, and that's where people's lives are changed at that level.
Yes. I'm gonna ask you one question, then I'll turn it over to Al unless Al have any questions. Can you explain, if you can, why some were so against Obamacare and why Obamacare was so good for some?
Oh, so was that to me? Okay.
Yeah.
Well, listen, it expanded Medicaid eligibility. So there was a certain cutoff based on income that people were able to get Medicaid. They expanded the federal poverty level so that more people, what you want to call the working poor, the working, underserved.
Yeah, exactly.
Underserved. We expanded Medicaid eligibility for that population. It created new product lines like the Essential Plan and the Qualified Health Plans. It gave tax credits to others. It mandated that there's a certain minimum set of 10 essential health benefits that must be included. It took away things like pre-existing conditions that couldn't be a factor when determining, if someone was eligible. So it checked insurance companies and made sure that rates were set at that was going towards health care and not to pan the pockets of wealthy executives. So I think it really did a lot to make access and affordability more available. So, and I want to check one thing. So when Al first started talking, he had said that our current membership of 530,000 members. I think he's reading from an old bio because as of today, our membership is 630,000 members.
All right. Yes.
We enrolled 100,000 people is a lot of people. And we are only one insurance company out there, but because of the expansion of the ACA and because of what it's done, if the ACA was not that needed, then why was there 100,000 people additional that we were able to bring on this year? Those are new members that didn't have health insurance before that. And so to increase membership by that amount showed you the need that was out there for healthcare and health insurance.
Wow.
Absolutely. Thank you. That's what's up. Everybody, we have Roger. Go ahead, Milner in the building of Metro Plus. And of course, we got Assemblyman Al Taylor in the building. This is Real Talk, and I'm your host, Bill Forster, with my co-host. And this is Real Talk. Listen, this is probably the only place you're going to get this kind of information. So please tell a friend and share it. If you're watching from the YouTube, or people watching it from YouTube, I see Michelle Meekins is in the building. She said, yes, Metro Plus in the building. Also, subscribe to it. Tell a friend, pass it on. If you're watching from Facebook, just let people know. If Facebook would have been down, we still would have went live today. We just went from YouTube. So you would have your way of sharing it and stuff like that. So, Al, if you have a question or anything you want to say?
No. This is amazing. I do want to circle back at some point where it's possible, Raj. One of the things, boots on the ground. What I'm seeing is a super heightened awareness for mental health. What does that look like? I was speaking with someone today. When I was growing up, they would say, okay, the person went to a party and somebody put something in their drink. And so, that's why cousin brother act like they act. But more than anything else, I think it's part of our denial as a people about mental health issues and the stigma associated with that. So with that getting, the need is greater than ever. And there was another one that crossed my mind. I think you might have mentioned suicide, especially teen suicide. Black and brown 11-year-old kids are killing themselves at astronomical rates, or at least attempting more than any other people group. So with Metro Plus, are you guys targeting communities to share? Unpack some of that view, because I know you gave us the broad view, but when people are on the streets and they see your symbols and everything that's going on, and we're doing book giveaways, and sometimes we're more interested in the immediate than the long-term goal. So what are we doing there?
Very, very good point. Very good point, Al. So there's a lot that we're doing. I'll address maybe two of them. So let's talk about homelessness, for example, right? Metro Plus is working closely with many local community-based organizations. We're working with our parent hospital system to address this increased number of homelessness. And many of the homeless population are, not always, but in some cases, dealing with not just the homelessness piece or experiencing homelessness. They also are dealing with mental health issues. And so, for example, I've had the great fortune to be part of 2 ribbon cuttings within the last 2 years, where Metro Plus has helped to build affordable housing for people who are experiencing homelessness. You wouldn't think that if somebody has health insurance, they would also be homeless. But in our very plan, we have upwards of north of 20,000 of our members are experiencing homeless. Like, how could you have health insurance but then also have insurance? It happens. And so we had to look within and said, before we even address potential members, what are we doing for the existing members that are in our plan that are dealing with this? So we've built a whole housing team. Literally, we factored into our budget the need to have nurses and other mental health professionals to help outreach to the existing members in our plan and get them into affordable housing. So, that's one thing that is and it is part of dealing with the various health disparities and the social determinants of health. But we were doing social determinants of health before it became popular.
Let me add something real quick. I'm sorry, Roger. You mentioned about the healthcare nurses. Are you in elementary schools as well, public schools, doing anything?
Yes.
Because one of the things that's happening, HH, Health and Hospital Corporation, has, they're hitting financial issues. So they're pulling back some of those nurse services that would typically be in the elementary schools, because I have 2 schools in my district that are having that issue. I would love to talk offline a little bit more about maybe being able to bridge that service gap. Thank you. I just wanted to throw that up.
I'm doing a lot, not me. Metro Plus is doing a lot with all types of organizations that, deal with elementary school, even, college level people who are dealing with mental health and issues like that. So last week, I was on a panel discussion with DYCD, Department of Youth and Child Development, and we did a similar talk. We call it the Barbershop Talk series, where we were addressing all of what you're talking about now with mental health disorder and the stigma around it and how to address it, how to see the signs. So working with organizations that also have a mission to address this, like DYCD, CUNY and Metro Plus is partnered to really address some of the college students who are facing some of these mental health issues as well. Working clearly with our parent organization and ACS. ACS is another city agency. I know I mentioned a lot of city agencies, but because we're a subsidiary of this health and hospital, those come to mind first, because those are immediate big agencies that are taking on some of these issues. So we work closely with ACS. We work closely with DYCD. We work closely with CUNY. We work closely with NYSHA to unpack and to address a lot of these mental health issues. We have some dedicated and very specific product lines that are geared specifically to addressing these issues. So, for example, Metro Plus has what we call a HARP, HARP, Health and Recovery Program. That program is specifically for members of ours who are dealing with mental health disorder. To have a product specifically to that line of business shows that we're committed to it. We have about 20,000 members in that line of business that we're dealing with on a regular basis to unpack some of the issues that they're having. We have some specialized programs like our HIV special needs plan. That's another one that is very geared and tailored specific to issues or crisis that we face in our community. So I hope I'm getting to your point about.
Oh, no, absolutely.
We 100% do. Metro Plus has a whole team of nurses and medical professionals in our medical management department that do case management, that do very specific care management needs delivery to members and potential members.
Excellent.
Prevention is also a big one. So we actually reward people for preventive measures in order for them to address these things. You gotta stimulate people to want to sometimes take care of their health. And one of the ways that we found to be very successful is our rewards program. We continuously see the uptick in people joining the rewards program and utilizing the benefits of it. So, doing things like early detection of different types of, breast cancer or cervical cancer or whatever it may be, early signs and early detection prevents it in the long term. We're rewarding people for eating healthy, drinking healthy, exercising. We give them points, and as they build points, they get to go shopping in our catalog. So not too many plans are going to reward the members for doing healthy things. And I'm very proud of the fact that that program is something that we were able to pass on to people.
Awesome.
And telehealth. That was another. I'm sorry, guys, but you gave me the platform.
No, go, man. Listen, let me tell you something.
Bring it.
I'll tell you, this is real talk. You talk it, you kick it. Long as it's listen. The beautiful thing is, and once you hear, you're always welcome to come back. And so anything that changes, and anything that Real Talk Chronicles can do to help get to spread your word and what Al and I are trying to give out to the community, you're always welcome to come back. All you got to do is tell Al, myself, my uncle, anybody, just say, listen, I want to go on Real Talk. I got some information we got to share, and you're more than welcome.
And that's what it's all about. I'd love to come on your show to bring updates. So if you'd have me back, I'll certainly like to do that. But I was going to say something like telehealth, like everybody, this whole concept of telehealth and telehealth. It is important. Telehealth has seen a lot of increases over the last 2 years, especially with the fact that people were remote and people weren't vaccinated at that time. So to be able to have an outlet to get your needs addressed through telehealth was very, very big and very important, especially during the pandemic, and especially for people in our communities. I keep going back to, the Black and Brown community and the Hispanic community that was ravaged by this, because that was their only way of having, an outlet to address, hey, I'm dealing with suicidal thoughts, and being able to deal with that. Hey, I'm having urgent care issues, but I don't want to go to the hospital because I don't want to get affected, but I want to get this checked out. So telehealth was extremely important during the pandemic, and we continue to see the number of people utilizing telehealth to avoid the emergency room or to take preventive measures as being something that we want to make sure people continue to have access to.
That's awesome. Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Assemblyman Al Taylor, and we have Roger Milner in the building. And your title again at Metro Plus, I just want to make sure everybody knows who it is.
I'm the Chief Growth Officer, and so mainly I'm responsible to make sure that people are educated about their healthcare options, to help make enrollment available for them and access available, and to retain members. One of my major responsibilities is also to not only listen. I didn't get into this just to be a glorified salesperson and sign people up. That's not my interest. I went to school and I got my degree in community health, and it's very important that community service, I should say, it's very important that I don't just bring in the membership and get them to the point where they sign. I want them to be healthy. And so retaining members is another one of my major responsibilities as the Chief Growth Officer, to make sure that we're retaining members and people are doing what they need to keep their eligibility and keep their insurance. So sales, of course, growth, of course, but retention, health education is probably more important than even my role as the Chief Growth Officer of sales.
Roger, you brought up some great topics, and I'm trying to I'm going to give you one, and then hopefully I can retain it. Al, help me retain this, because I want to ask you about first. Al, just make sure I remember this. I want to talk about how you're dealing with mental illness and health like that, because you talked about that. I heard you mention that. So I'm going to ask you another question, but then I want to make sure I don't forget that, because I want to ask you with that, because that ties into how people of color are getting caught up with, because law enforcement is big now. That's a big topic with mental illness and law enforcement. So that might be your personal feelings, and I don't want to put you in any situation that will jeopardize anything that you conflict of interest. So with that being said, I want to ask you though, it seems like Metro Plus is very conscious in dealing with the people of the community. You know, I mean, we see a lot of commercials or other insurance agencies and stuff like that, and they're humorous and they get out there, but listening to what you're saying and listening to the comments and people are talking about the information is very informative, and you're working with people like Al and my uncle and other people, and like, where does that start? Was Metro Plus always a conscious organization? Talk about that.
Yeah. So just for the listeners of your show who are not aware, Metro Plus is a fully owned subsidiary of the city's public hospital system. So just like you have many other city agencies and mayoral agencies like the police department, the fire department, the corrections, the Department of Education, another big mayoral agency in the city of New York is Health and Hospitals, Health Plus Hospitals. That's our parent. That's our owner. Health and Hospital is the city's public hospital system. It's not for profit. And I'm not knocking any for-profit institutions because there are some great ones in this lovely city of New York that we live in and that we work in. But it's a different mission. You know, I'm not going to name hospitals by specific name or health systems, but they have, you know, shareholders and they have donors and they have philanthropists that, you know, have a different objective. Our only objective is to serve the public without profit being at its core mission. And so I think that our culture stems from who owns us and who, you know, we report to. The president of Metro Plus reports to the president of Health and Hospital. The president of Health and Hospital reports to the mayor of New York. And so, you know, we're rooted in the mindset of government and what government wants us to do, which is to be there. And so we're always advocating for keeping public hospitals open, making public hospitals just as competitive as private hospitals from a look, from a service delivery, and that trickles down to us because we're an extension of them. Our new tagline is, let's get healthy together. If you look at the sides of buses and the subway ads and our social media, you'll see this new tagline called Let's Get Healthy Together. And we did that because of we're responding to what's going on in the city right now. And so I thought it was so fitting that, you know, our marketing team came up with the slogan and our media agencies because it's needed right now. And to answer your question, it is rooted in who we are. Our CEO is a nurse. Excuse me, well, she'll kill me if she hears me say that. Excuse me, she's a doctor. And so you gotta edit that part of the but you know, she's a pediatrician by training, and she really does believe in what she's representing, and she drives us all to make sure that we never forget. We don't want to be a big commercial plan. I won't name any. We don't want to be them. We want to be us. We want to serve those populations they don't want. The ones that cost them a lot of money, or the ones that they try to stray away from. We're going after the sickest of the sick, the left behind, the people who are underserved. And that's why you'll always see us in those communities working to get the hardest reach people. It's easy to get the people who are on the surface, who you see and get insurance for their jobs. What about those hidden people, those undocumented, who are living amongst us, working amongst us, contributing to the city, but are fearful to come out and be seen because they don't want to jeopardize their status? And I'm not trying to get into the politics of it all, but they have to be healthy. You know, we don't want unhealthy people in our city. And so we have to embrace them while they're here. And so we educate them about which products they're eligible for, as long as we stay within the rules. You understand? So yes, it is. We are rooted in public service. I preach public service to at least my staff all the time. Don't forget what you're out there doing. I don't care about a sale. Sales come easy. I want you to remember why you're working. Don't worry about getting a number. Worry about getting someone healthy.
Yes, absolutely. I have a question and I think I have a statement. I have one from I think Facebook and one from YouTube. See, they made me put my glasses on now. So Pinky said, so she's asking the question to you, Roger. She said, so folks who need your service, can they get this plan? I mean, what do they have to do? Just apply? Is that right?
Applying has never been more easy. I tell you. Well, first, if you don't mind, can I give out my 800 number so people know how to?
This is where you're supposed to give it out, brother. Go ahead, give it out.
All right. So, in order to reach us by telephonically, you can call us at 855-809-4073. I'll repeat that. It's 855-809-4073. And if you just press #1 for English, if you're an English-speaking person, and then after that, #3, you'll be connected to a live agent that can help you walk through the eligibility requirements, help you apply telephonically. We're available to meet people in person if they want, because I do have staff out in the public. And you can also go on our website at www.metroplus.org. That's www.metroplus.org. And you could find a representative in your community. You can find a representative who speaks your language, because we have something called our virtual office. And that virtual office is meant to let people find, if you're somebody who speaks Urdu or Bengali, or you speak Russian, you can find a sales representative who speak that language, who's in your zip code in your community. So applying has never been easier. We certainly can help you, and we can help you apply through the marketplace so that you can get any tax subsidies and credits and financial assistance that you're entitled to as part of the ACA. Or you can walk into one of our community offices. You know, Al knows. Al's been out there. He's been, listen, Al came to a Halloween event one year at a grand opening of a new community office right there on I think it was Adam Clayton Powell on 125th Street. And so we have these local offices that people can walk into. We have RVs that you can go on. We have people in all of the health and hospital facilities. And then we'll come and do home visits if we have to. We'll come out to your agency if you need us there.
Well, you know what's so funny? If I must date myself, I'm from an era where the doctor used to make house calls. I mean, I think you remember that doctor used to come by and check on you.
Oh yeah,
we'll do it. We'll do it.
Exactly. So I mean, that's something that is so gone. I mean, times have changed, considerably. But I mean, that was just something like to be blessed that the doctor, if you were sick, I don't know how he found it in the schedule to this day. I mean, back then, but they would come by and check on you in your house and stuff like that. Michelle, she's chiming in from YouTube. She said, those are the people who work in the mom and pop stores, I guess that she's saying. She also said Metro Plus also has expanded their services. I remember when they did not have any urgent care sites, and now they have several. I am also pleased that they are a part of this service. Awesome.
Well, that was another reaction. Like, I pride myself on being an executive that doesn't sit in my office all day. I am out there because I want to understand, not just from my staff telling me what's needed, but I'll sit on an RV, I'll listen to what consumers' needs are, and then I take that back to my peers and say, this is how we help shape benefit designs. Mm-hmm. The only way I'm going to be able to advocate for people and what their needs are is to say, if I'm out there and you say, well, I think that your plan should add these additional services, I am your voice to go back to the chiefs at Metro Plus to say, when we're doing our new benefit design for the new year, this is what we need to include. I'm always the one fighting for lower cost monthly premiums. I want to make sure it's as affordable as I possibly can, to the point where sometimes I'm the outsider in the room, but I'm the one to say, no, that we have to lower that price even more. And
awesome. Pinky said thank you. She said thank you for that, Bill and Roger. And make sure Al and I will try to put that number in again. Before you go, Roger, you definitely just give that number out again. Let me ask you a question, and this is a personal question about you. A lot of people do jobs because they get jobs, but it seems like this is one of your talents, because it seems like you care, like you fit this mold. Like when I was a law enforcement officer, when I did patrol, people was like, "Yo, you're a good cop, Bill." Because it wasn't about always locking somebody up. It was about interacting with the community and understanding that I had discretion and I knew how to use it. And what I'm seeing right here, what you're saying, you said a couple of things. You said, you're that person that will advocate for the people. You sit on the truck, you listen. Yeah. Tell me, where did that part of you come from, and how did that implement? And that seemed like you're being able to get an avenue, and you got a lot of longitude and latitude from whomever you answer to do that. Yeah,
you know what it is? It's well, honestly, I didn't know I was going to land in healthcare. That was not, what I thought I was going to do coming out of high school and coming out. Well, when I first went into college, I had thought I was going to go down the path of being this criminal defense lawyer, fighting in court. I think I still always cared about it because I wanted to be on the defense side. But anyway, my mother and teachers used to tell me you like to talk a lot, so why don't you be a lawyer? This way you can run your mouth fighting cases all day. Yeah. But I got derailed. I did go to City College originally, and I was in a urban legal studies program. But then along the way, I was too busy playing basketball and sports and kind of failed out of school and had to come back. But I got a job as a sales rep. I started out as a sales rep for this very same company back in the late 80s. Wow. And I found it to be very motivating. I was very motivated by, after I would sign someone up, to see them come back to me months later to say, you know what, had it not been for you, I wouldn't have been able to deliver that. I had a premature baby. And you saved that baby's life, because if I didn't have insurance, I might have not got the care I needed to deliver that premature baby. Or that person who had a stroke and told me, thank goodness 2 months earlier, you helped me sign up for health insurance and I didn't have to worry about the bill I was going to get. Or that HIV person that didn't know where they were going to get their meds from. I can go on and on about the impact to people's lives that keep inspiring me. When I look at homeless people that we sign up, or I got a better one to answer your question, and this is more recent because of the pandemic. When I was out there at the grittiest part of the pandemic, the gritty part, I'm talking April, May, and June of 2020, when it was hot and heavy, to be at those food feeds, we gave out so much food with people like Al and the potential mayor when he was, he still is borough president, to be out there seeing people so thankful for us giving them food and how appreciative they was to get these meals, to be at these test and trace places when people were getting COVID tested, to be at these vaccination drives. When I see us helping people, it just makes me feel good. And it makes me go back to my staff and says, this is what we are here for. This is why it's important to us to do this, because I see it. When the pandemic first started and we got the call from the governor, because remember, we're tied to health and hospitals. Remember Elmhurst, I'll use them example. Yes. They were over flooded with people coming in and dying. I was there watching those trucks pull massive amounts of people out who had died. I didn't want that to continue. So when they called us to say, we need Metro Plus to step up and help us at the hospital system, half of my staff was redeployed to go do things like, we were calling doctors all over the country to recruit them to come to New York to help health and hospitals with all of this influx of people, to make those arrangements for them to have hotels to stay in and their airlines. That was impactful to me because I knew we were making a difference. When we had to help HRA process all those applications for people that was applying for public assistance because they lost their jobs. When we had to help the Department of Employment help people who were losing their jobs and trying to find new jobs and change their industries. That was so gratifying to me. And so as long as I keep finding value in this healthcare system and what it's accomplishing and seeing the impact that it's helping, I'll do this. This will be the thing I do for the rest of my life or the rest of my working career.
Absolutely. Wow. Absolutely. That's awesome. Yeah. I mean, I applaud you, and I'm so glad that you Al put you on the spot. That was a real talk moment when we was at the I said, yo, you need to come on the show. He was like, he's like, come on, Monday.
What's so funny? I got to do a lot of those things, like be out at night, going to these different events, and there's an impact to your family life when you're out there trying to be that face.
Of course, absolutely.
And so you do give up a little bit, just like an athlete, and they're always traveling. In my role and in sales, and we always have to be out there networking and doing events, evening, weekends. And I tell my family, I do it too for them, and I have to provide for them. But when they come out with me sometime in the field and they see what I do, then they understand why daddy's out there working late at night.
And of course, it's rewarding, especially, like I said, all three of us, from what Al, I know what you do. You have a great support system. Valika is part of this. And Roger, yes. I'm sure your significant other, your loved ones understand. Pinky said, thank God, Roger. Thank God, Roger, because healthcare is very expensive. Thank you for what you do. She said, affirmation, we need more Roger Millers in the world. Yes. I agree with that. Like I always said, and I'll say it again before we even leave tonight, that any information, any updates you have, reach out to Al, myself, my uncle, and you can always come back on the show. Like I always say, once you're part of the show, your family, you're always welcome back anytime you want. Let me ask you a question. Michelle Meekin said, awesome. My wife, she's timing in on YouTube. She said, excellent show, gentlemen. Thank you.
Thank you.
Can I get one point of question? This is a very critical time. This time of year is the most important time of the year, especially in healthcare, health insurance. We're dealing with many open enrollment periods. I know you hear that term a lot, open enrollment. So if I could, say one thing before you kick me off, is that
no. When we leave, we're leaving together. We're leaving together.
Open enrollment for the Medicare population, all of our seniors who have Medicare and or Medicaid. This is the time where they could either get health insurance for the first time or switch health coverage. So some key dates that I want to throw out to your listenership: October 15th to December 7th is a critical period for people with Medicare, where they could change and switch and join health plans. So that's one open enrollment period. Anybody who is not eligible for government-sponsored insurance like Medicaid, because they make too much for their income and they had to wait to the next open enrollment period. The open enrollment period for those who want to get health insurance for the first time because they don't qualify for Medicaid or the essential plan, open enrollment is starting on 11/1. For anybody eligible for, let's say, the qualified health plans. Anybody who works for the city of New York who want to change their health insurance, they get to do it between November 1st and November 1st and November 30th. So all of these different open enrollment periods are all happening like in the next week. And we need to raise awareness as a community to let people know the options, and we know we're not the only option, but we will make sure that we're an option that stands by our word and try to do the best for our members. And customer experiences is key for us. So I just want you to know that all these open enrollment periods are happening right now. This is the time where you have to raise awareness for people so that they don't miss out.
Well, like I said, go ahead, Al, please.
I was gonna ask if they call 855-809-4073 in www.metroplus.org, will they find that information?
Yep. All of the representatives know these various open enrollment periods. We're putting information up on our website so that people can find information about open enrollment on our website. I want to do more talks like this all throughout this period of time. Any opportunities that me or my staff can go on to spread the word, whether it's on radio, whether it's on TV, whether it's in print. If you want to go out and hit the streets and do some in the community events,
Done.
Let's do
it. Done.
And you too, Mr. Foster.
Oh, absolutely. Please don't call me that again. Call me Bill. I appreciate it. Unless we sign some contracts, listen. But like I said, and I'm so glad that Al, got you to do this, because Al knows this. I'm all about giving information to this listening audience, and how far is Metro Plus? Like, is it just New York? Is it worldwide?
Yeah. We're a local plan, so our service areas is the 5 boroughs, and mainly because, again, our tie to the city of New York and our relationship with Health and Hospital. However, if any of our members are traveling abroad and they have a medical emergency, we're responsible to cover it. If you're a New Yorker and you have Metro Plus, if you're traveling on your vacation in Jamaica or something like that, and you have an incident, don't worry, we're responsible to cover it. You know, if you're in Jersey and you're at your cousin's house and you're jet skiing, we're going to cover any emergency. So, you know, even though we're local, we cover all out-of-state emergencies that any of our members have out there.
Okay, cool. Because I have a question from YouTube. Michelle says this. She says, "What services does Metro Plus have for patients with mental illness and chemical addictions?"
Right. So I had mentioned earlier we have a health and recovery, a HARP program. It's called Health and Recovery, HARP, Health and Recovery Program, and that's a product specifically for people living with mental health disorder. We have tons of programs in regards to our case managers. Case manage people who have chemical dependency all the time. So once someone is engaged in care and they have a primary care provider, their primary care provider is usually going to reach out to our care managers to work out a care management plan for somebody who may be suffering from substance abuse or any type of other addiction or issue that they may have. So it's usually, you know, they start out as a member, they're assessed by their primary care doctor, their primary care doctor's recommending them for some type of advanced clinical programs that we may have. And we work closely with so many other various CBOs to troubleshoot, you know, things that we don't have the specialization in.
Awesome.
Wow.
Let me ask you a question. Matter of fact, Al, can you put it in the chat, or I'll try to put it in the chat? Roger, give the number again, because I think Malika put it in the chat.
855-809-4073.
Yes.
Yep.
Go ahead.
Let me do it again. Help question. 855-809-4073.
Yeah.
And www.metroplus.org. Correct.
Right. Well, we're gonna put that number in again.
You know, if you're open to it on another show, I will be happy to bring some of our clinical staff on. If your audience wants a more in-depth discussion about, we have medical directors who look like us, you know, who are passionate about what they do just as much, and they'll be honored to get into like detailed discussion about, from a clinical perspective, how they case manage our existing members and what available services are available to applicants and non-members.
Just say the word. Like I said, I'll make sure when we go in the green room, I can give you my information. But you can always come. Al's here once a month if you just want to do it on Al. But if you want to come and give that information, if it needs to be before, we have Wednesdays, we have other Mondays. So that information is always geared, and you are always welcome. Like I said, you can always come back. I don't have too many more days to add to the show, but you can come in sometimes, you know, with the doc. You can come in with Allison. You can come in with Al. You can come in with Kevin and I. The bottom line is you're giving a service to this community, and we will never stifle that. Al and I will never stifle that. So,
you got a connection to me, so we could do a panel. Like if you want the perspective from the insurance carrier, we have medical directors and we have nurses and doctors. If you want a perspective from the hospital system, I could reach out to, you know, one of the hospitals and say, I need a clinical person who's in the ER or in the psych unit or in social work. You know, I think that might be another thing, to bring in social workers who work within Health and Hospital or within Metro Plus, because the doctors could talk from one perspective, but the social workers can talk from another perspective. So, you know, I'm here for you. I'm your plug in that area.
Well, listen, like I said, we're definitely going to talk. We're going to get those numbers together, because, like I said, we could do it on Al's next show. We could do it on one of the Kevin and I Wednesdays. We could do it on the Allison show. We could do it on anybody's, Pastor Graves, because the bottom line is we all in this to win. We all want our people to you know, for the betterment of our people. Let me ask you a question.
You had a mental health. Yes, Bill, you had a mental health treatment question you said remind you of.
Yes, I think I just read it, but let me now. This is the question I want to ask you, and Roger, I'm retired, so I say what I want to say, and you know, and I always tell Al that, and I say that to those that are working. Please don't ever jeopardize your profession for your realness. What we say at the bar or at the dinner table is what we say, but I always say that because due to what we've seen from Afghanistan, Haiti, and things of that magnitude, we're trying to get these people in the country, whether you agree or disagree with that is a whole nother topic. And not to say that you don't, but I just always give a person a longitudinal latitude. But if these people were in New York, the 5 boroughs, if they're scared of healthcare, if they're scared, they don't know how to get healthcare, like, how would you get them to sign up? Because the people, not from, first and foremost, people kind of like healthcare is on that, I don't know, it's kind of like I'm scared to get it, can I afford it? There's so many loopholes with healthcare. And go ahead, go, Roger.
A lot of people, so without getting too into the law of it, a lot of people, there was this thing called public charge, where people thought that if I took certain health benefits, it would jeopardize my immigration status. And that was something that past administrations, held out there for a long time. And it did put a lot of fear in immigrant communities and immigrant populations. But I don't know if you're aware that a lot of the public health charge rules have been overturned and dismantled, and modifications have been made. So obtaining government-sponsored health insurance does not jeopardize or is not considered a public charge. So people, that's a whole nother thing. I mean, if you want me to bring on the lawyers and the advocates, they could speak to this real easy about the rules around who's eligible, who's not eligible, and what other things are available. So all children, every child is eligible for Child Health Plus.
Let me interject for 1 second, because you're not going to say this anymore. Al, if you don't mind, next Monday, if you don't have any pertinent topic that you want to talk about, or we don't have anybody lined up, can we have Roger, if he's free, to come back next Monday with your staff and whomever you want to hook up, and we can just go into that? Next Monday. I'm talking about your Monday, Al. Your Monday.
Oh yeah, I can't believe you asked me that, man. Come on, I'm offended, man.
No, because the bottom line is, Roger, the one thing that I say that is because we talk on current events all the time. So, God forbid, unless something tragic happens in the world, we're going to discuss that. But listen, let's set up the following Monday in November, the first Monday in November. And like I said, with Al's permission and blessing, that you can bring out your whole staff and whomever, and we could just have a whole dais of everything that you want to present to community. And we can just run it off, like you said, we can deal with mental illness, we can deal with people signing up, we can do anything the topics that we've discussed tonight. The three of us will sidebar and we'll get that dais together, and we'll send a link. If you can, we'll even put the flyer that we're having your Metro Plus or Roger Miller on, and we'll just go from there. Fair enough?
Absolutely.
So whatever that date is in November, everybody out here, somebody in the audience looking, tell me that date, that first Monday in November.
That's the first. It's not the first. That's got to be the third, right? Or the second. There's something going on.
What is something going on? Go, Al. Well, Al, you check and let me know. And if not, it's November 1st. And if not, we'll do it Wednesday. We'll do it Wednesday, another Wednesday or something, because the bottom line is we want this information out. We know politics. We know the mayor race is November what, the 6th or something, Al, or something like that.
Yeah, it's that first Tuesday in November.
Okay.
So you've got that happening simultaneously. So that may not be the best place to jump in at.
So how about let's do it. We'll come off when we come offline. We'll look at it. We'll do it a Wednesday. And Al, you join that.
Let's do that.
So, Roger, we'll do that maybe in 2 weeks on a Wednesday show, and your people can come in and Al. See, the beautiful thing about the co-hosts, they all can intertwine and they join in with each other. So we'll still set that panel up. Yeah. Maybe we'll look at 2 weeks. Malika, Al, somebody, we'll look at 2 weeks from, October 20th.
Okay.
So, Al, can you do it October 20th?
I'm looking now.
See, everybody, this is real talk. We do it right here on the spot. We don't play any games in here.
Exactly.
We put the dates out right here because the bottom line is, like I said, that Monday will be real hectic. Al, I'm sure you'll probably just be chiming in from somewhere. And
I will. I will make it work. I got a couple of community meetings. So what we'll do is, one of the things that I learned in the COVID-19 is you can multitask on like 4 different platforms simultaneously. You just get up and stand over there on another one. It saves you a lot of car fare. But I think it's a wonderful idea, and especially with the what did you call it? The open enrollment, which is 15 October to the 22 to the 7th of December, and then there's another one that pops up on November 1st. I didn't catch the fall off. But folks, if you want to get this information, go to 855-809-4073. Dial up, you'll get it, or www.metroplus.org. Certainly, we want to thank you. It's called, what's your thing? Let's get healthy together. Listen, we're going to come back at you in 2 weeks. It's going to be the doctors in the house.
Hold on for a second. Before we get out of here, I just want to read some comments and statements. Piggy said it's the stigma of cost and the sharing your personal information. And if you do not have a job, no money, no insurance. Roger, what do you say about that? Because a lot of people feel like, insurance is a business. How do you got to get paid? Somebody's taking something out of something.
No, we got a product for everybody. We got a product for people who are low income. We got product for people who are undocumented. We got a product for seniors, people who work in small businesses but don't get health insurance. So someone should never feel like that we don't have something for them. We can always fit something for them. And as far as the stigma, listen, I tell people all the time, I have clients or members who they might have been working for most of their life and they had insurance through their large corporate jobs, and they think that when they're sitting in like a hospital like NYU, that everyone sitting in there is all somebody who's rich or upper income. I'm like, that's not true, because sitting in Mount Sinai or an NYU or some perceived better institution, Northwell, whatever it is a Medicaid recipient sitting right next to you. And that doctor doesn't know the difference between, because the doctor's a paid salary employee of that system, and they don't know if they're treating a Medicaid recipient or a middle income person. So, we should not worry about that right now. It's very affordable. There's always can be improvement. We're not in a country or like Canada where health insurance is free, but there's a lot of opportunities to get help, and we bring that to you. We help people get the benefits that they need. Whether if you're a Medicare recipient and you need extra help, there's all types of programs that a senior could take advantage of that my staff is skilled with walking them through the process. And I'll say this: NYC Cares. Help, because we're owned by Health and Hospital, NYC Cares has a program for those who don't qualify for government-sponsored health insurance, where they can get fee scale, and they can get doctor's visits as low as $15 a month, or $15 a visit. Excuse me. They can get prescriptions for under $10. There's all types of ways that we can skin this, and NYC Cares is an extension. If someone doesn't qualify for something we have, which is kind of unusual, NYC Cares is the next step, and that's through our parent organization, Health and Hospital.
Awesome.
So, I think they should be on the show with me, because they could talk about that program as well.
Well, the ball's in your hand, and you're going to set it up. So everybody, we're shooting for that date in 2 weeks on a Wednesday. Roger, before we go, I always ask people to give some positive affirmation, some word of advice and wisdom, whatever it is, any topic, whatever you want to touch on, before we say goodnight, and then Al will do it, and then I'll close out. So first and foremost, thank you for having us. Thank you for being here with us. We appreciate you. You will be back as much as you want to come back. But like I said, we want you to bring that staff and so they can come back and tell everybody the do's and the don'ts, and let them know that show may go a little over an hour, because there's going to be some heads in here, and we want everybody to get their speech on and talk. So please, before we leave, give us some positive affirmation, love, whatever it is you want to say. You want to talk about?
Information is power. Make sure you get the information that you need to be able to improve your health. Don't Don't let things like money or access be a barrier to good health. Let's work together to champion this cause of, good physical and mental health out there. And, all I can say is, like, I love when I work with people who are like-minded and who want good for the community that they serve. And, I can't thank you guys enough for making me a part of your community. I want to, stay a part of your community, and hopefully if I touched one person on this call tonight to help them, see a better path to living a healthier life, then my job is done. And thank you for you. I want to thank you guys. You guys are the ones who put this platform together. So we should all thank you for putting on platforms like this.
Thank you.
Thank you. Al?
Listen, I am so elated, and I think what you said earlier, Bill, we put Roger on the spot. He was there, low key, taking it easy.
Yeah,
and it hit me like, hey, we're gonna have a guest with us this week. So the people that are listening, you're listening to a genuine person right here. What you heard is the gospel, and what you see is the gospel, because he didn't hesitate, he didn't stutter. He said, okay, when and where. And thank you for that. We appreciate all the information. I got a lot of information, so I'll blow up your phone tomorrow afternoon as soon as I finish the morning meeting, so we can strategize and take this back to the streets. And it's important. I think if I'm leaving something with folks, get involved. It's great to be in this space, in this platform. What did you pick up that you can share for someone else? I thought about over the last couple of months until till maybe July, we gave out over 80,000 PPEs on the streets, just hitting the streets, giving them out, because the virus was picking up. I forgot the name of it at that point, but it was spiking in the Heights and hitting in Harlem. So we have to get engaged, become more engaged. So this is a great platform to share information. But once we turn this off, what are we doing with what we know? And I always tell people, faith without works is dead. Don't talk about it, be about it. Tell somebody about the good news. And if you found something that's better, that you think is more affordable, then let's have that conversation and see if we can do what they call first right of refusal. Like that. Can Metro? I mean, he's a ball player. You have a contract before you can leave. That people have an opportunity to make that offer too. So don't walk away. If there's going to be something in this conversation for you, your neighbors, or your community. So don't miss it in 2 weeks coming, October 20th, 7 p.m. And get your chicken early, because we're going to be here for a minute.
Yeah, we're going to be here for a minute, man. And everybody, listen, please, there's a vote November 2nd. Please get out and vote. We know who we want, but you still got to put them in office. Cut the BS. If you didn't vote, I don't want to hear it. Don't talk to me. You know what I'm saying? I mean, I'll ask you why you didn't vote, but don't. I'm keeping it real. Be in it. Sometimes doing something is better than doing nothing. And the bottom line is, just stay positive. Stay. If you're not vaccinated, I don't know what to tell you, but wear your mask. Right. Be protected. Everybody, when we were together, we were all vaccinated. We all felt good. I was instrumental in getting Al. Al and I talked about being, the vaccination.
Because we wasn't doing it straight up.
Exactly. When we first came out, we was like, nah.
Most of us wasn't. Most of us wasn't.
But like you said, we're all trying to be here. We're trying to see another day. And like I said, Roger, thank you, everybody. And the best slogan I can give you before we get out of here: if you could do anything in this life, just be real. Real talk, man. You know what I'm saying? Everybody, Wednesday, I'll be here with Kevin and Chuck, and we'll be talking about other things. We definitely will pick up off the conversation we had about the police incidents. At Roger, also, you can let everybody out here, please. This is on YouTube now, so you can share it to all your people. And
good.
Okay?
Yeah, send it to me, and we'll definitely make sure that we socialize it and have it, tagged on our site as well.
Absolutely. Everybody, good night. Real talk. Yeah, real talk.